Hello everyone. Today we will go through the topic pathogenesis and clinical manifestation of syphilis. So before we study regarding the pathogenesis of syphilis and the clinical manifestation which includes various stages of syphilis, we need to have a background knowledge regarding the microbiology of the syphilis. That is the etiological agent which is known as Treponema pallidum and also mode of transmission of syphilis. Coming to the microbiology of syphilis, syphilis is known as king of STDs, that is sexually transmitted disease, and this is caused by an organism called as Treponema pallidum. Now these Treponema pallidum, they are classified as spirochetes. They are spiral bacteria, gram-negative bacteria, and they are actively motile, which means that they possess flagella. Now, unlike the normal gram-negative bacteria, they have got a very complex cell wall structure, where you can see here the cytoplasmic membrane it is embedded with the flagella, which protrudes out through the peptidoglycan layer, and it projects out through the periplasmic space, but it does not project out of the outer membrane. The flagella, it is present in the periplasmic region only. Hence it is known as endoflagella. And this flagella provides, or it gives the bacteria a corkscrew type motility, which enables the bacteria to penetrate the mucous membrane or the skin. Now, these bacteria are very thin and delicate and hence required dark field microscopy or phase contrast microscopy to observe them, or other staining techniques. And unlike other bacteria, they are uncultivable in vitro condition, and hence they are grown in rabbit testis. Now coming to the mode of transmission of the bacteria or syphilis. Syphilis is transmitted both venereal mode or non-venereal mode. Venereal mode, that is, it is acquired through sexual contact. However, the other modes are by direct contact with the infected lesion, which contains the bacteria, or it can be transmitted through blood transfusion, or it can be transmitted through transplacental transfer, that is from the infected mother to the fetus. Now, the incubation period is usually 9 to 90 days, and about 500 to 1000 bacteria are required as an inoculum to infect a human being. And the bacteria rapidly penetrates through the minute abrasion on the skin or mucous membrane. Then it will enter into the blood and the lymphatics and produce systemic infection, and also develops metastatic foci. And it also produces the primary lesion, which is known as the chancre. And during this time, the blood is infectious in nature. Now coming to the pathogenesis of syphilis. The syphilis progresses through different stages, which includes primary syphilis, secondary syphilis, then there is a latent syphilis, which is followed by tertiary syphilis. This tertiary syphilis is mainly responsible for the fatal condition. Now have a look at primary syphilis. Primary syphilis is the first stage which is characterized by single, painless, circumscribed, indurated ulcer with thick exudate. And you can see this are single, that is ulcers, and they are known as chancre. Please remember this word, chancre. And these chancre, they are often they are painless and they are present in singles. And they have got very thick exudate which is rich in the spirochetes. Multiple lesions are seen in case of HIV infected people. Along with that, the lymph node is also infected and there is lymph node enlargement where you can see discrete, rubbery and non-tender lymph nodes upon palpation. The chancres are present at the site of inoculation, which means they are present in penis, cervix or labia and anal canal, rectum or mouth in case of homosexuals. This stage lasts for about 3 to 6 weeks and heals without any treatment. Hence, this stage is usually gone unnoticed by the patient. From there, the bacteria again spread into the blood and it progressed to secondary syphilis. So, once the secondary syphilis usually develops within about 2 to 8 weeks after the disappearance of the primary chancre or the primary syphilis. Here, usually affected sites are skin and the mucous membrane. Skin and mucous membrane are usually affected. So, skin rashes are seen and they are usually maculopapular rashes which are present in palm and soles. And apart from that, another lesion or the manifestation which is seen as called as condylomata lata, which is seen at the mucocutaneous junctions, and these are mucocutaneous papules. They are mucocutaneous papules which coalesce to form large pink or greyish white lesions, wart-like lesions. And they are usually seen in moist intertriginous areas such as perianal region, vulva and scrotum. Apart from that, mucus patches are also seen on tongue. They are seen on the tongue, which is due to the mucosal erosions. And this is accompanied by systemic symptoms such as fever and swollen lymph nodes. Untreated conditions progress to the latent phase and this occurs for more than a year. The latent phase actually is the absence of any clinical symptoms, but it is microbiologically active. Hence, serological tests are positive. Serological tests are usually positive. And this is followed by tertiary syphilis. So, about 15 to 30% of the untreated cases, they progress to tertiary stages or tertiary syphilis, where symptoms are usually seen on the skin, heart and the central nervous system. The skin, it presents, the lesions are usually seen on skin and bone. The lesions are usually seen on skin and bone, and this is called as gummatous syphilis, where gumma, that is gamma, that is the destructive granulomatous lesion. Granulomatous lesion which is present, which could be occurring on any of the organs, but it is mostly seen on skin and the bones. You can see it over here. And the other symptoms, as we have already told, that is present in heart, it's seen in heart, and it leads to cardiovascular syphilis, and this is characterized by aneurysm of ascending aorta or aortic regurgitations. And neurosyphilis is characterized by meningitis, meningovascular syphilis, tabes dorsalis, which is demyelination of the posterior column, and also general paresis of insane. So, apart from this, the syphilis is also transmitted from infected mother to the baby or the fetus in uterine conditions also. And accordingly, it leads to congenital syphilis. Congenital syphilis may be classified as early manifestation and late manifestation. It could be classified as both early manifestation and late manifestation. Early manifestation occurs within 2 years of age, where the affected baby shows the symptoms such as rhinitis, then mucocutaneous lesions, and bone changes, followed by lymphadenopathy, and also hepatosplenomegaly. The baby shows hepatosplenomegaly. And the late congenital syphilis or the manifestations occurs after 2 years of age, and the patient presents the features such as saddle nose, which is due to the destruction of the nasal cartilage, frontal bossing, which is due to the projection of the frontal bone, Schaeber-Sins, you can see the bones projecting bones, and also Hutchinson's teeth. Here you can see the top incisors, that is notched incisors, and also mulberry molars. And some cases ragates are also seen, which is actually the scaly lesions which are present on the angles of the mouth. So, this is what is regarding syphilis. And to conclude, syphilis, it is a sexually transmitted disease. It is caused by a bacteria, Treponema pallidum, which is gram-negative spirochete, extremely thin and delicate bacteria, and it is transmitted through the mode of transmission is sexually transmitted, or it is non-venereal mode such as direct contact, blood transfusion, or transplacental transfer. After the inoculation, primary syphilis develops, which is followed by an asymptomatic period, and then a secondary syphilis, which is again followed by a latent syphilis where there is no symptoms, and the treponema is present in the latent stage where there is clinical symptoms are absent, and this is followed by the fatal or morbid conditions such as tertiary syphilis, which is characterized by gamma, neurosyphilis, or cardiovascular syphilis. The main thing which you have to keep in mind is primary syphilis is characterized by painless chancre, Then secondary syphilis, this is characterized by systemic lesions, that is rashes, then mucocutaneous lesions or condylomata lata and mucus patches. And then there is a latent period which occurs for more than 1 year, and then followed by the tertiary stages, which is seen throughout or about more than a decade. Okay, so this is what is regarding the pathogenesis. Thank you.